Did you know that Sjögren's can affect you from head to toe and affect multiple organs of the body? Let's go over the early warning signs of Sjögren's. Early warning sign number 1 is fatigue and brain fog. Because Sjögren's is an inflammatory autoimmune condition, it can present very early on with just brain fog and fatigue. Now that alone isn't good enough for the diagnosis, but you should be aware that it could be an early presenting sign. Now sign number 2, and that is dry eyes and dry mouth. Sjögren's can attack the lacrimal glands and the salivary glands, causing the dry eyes and dry mouth. Oftentimes, doctors are looking for this to diagnose Sjögren's. However, it doesn't always have to present this way. That's why it's so tricky. But typically, yes, patients can have dry eyes and dry mouth. Sign number 3 is joint pain and stiffness. You can get joint pain and stiffness in Sjögren's, and it can look like rheumatoid arthritis and other autoimmune conditions, which makes it so tricky. So if a patient has joint pain by itself, could it be Sjögren's? Possibly. But more likely, if it's just joint pain by itself, it's probably related to either rheumatoid arthritis, psoriatic arthritis, or some other arthritic condition. But if you get dry eyes, dry mouth, and arthritis together, you gotta think of Sjögren's. It may not be rheumatoid arthritis or an associated arthritic condition. Now I mentioned dry eyes and dry mouth, but you may be surprised to hear that you can also get dry skin and dry genitalia as well. But patients don't talk to the doctor about the dry genitalia, so there can be vaginal dryness with Sjögren's, and it can be embarrassing for patients to talk to their doctors about, but that's something that does need to come up with patients and doctors in a conversation, because it does affect the quality of life for patients. Now another warning sign of Sjögren's that can be missed easily by doctors, even rheumatologists, is the nervous system. So Sjögren's can attack the nervous system and can cause peripheral neuropathy, where it causes tingling and numbness on the extremities and other parts of the body. But not only that, it can also cause autonomic dysfunction. The autonomic nervous system controls many different organs of the body. And when the nervous system gets attacked with the autonomic nervous system from Sjögren's, it can cause a fast heart rate and dizziness, especially when standing. Sometimes patients even lying down. Patients can have trouble with sweating. They either sweat too much or too little. The autonomic nervous system also controls your digestion as well. So there can be digestion problems. So the autonomic nervous system controls your fight and flight mode, and also the rest and digest mode as well.